Hello, everyone. My name is Marty Guthmiller, CEO at Orange City Area Health System. Really excited to put this video forward to you today and introduce and welcome Dr. Tyler Faber to Orange City Area Health System and our medical team. Dr. Faber will be joining our family medicine team, also working in our ER and offering OB services as well as prenatal counseling and, of course, birth care. So we're really excited for Dr. Faber to join us, further rounding out our diverse team of medical providers here. So welcome back to Northwest Iowa.
Thank you.
We're really glad you trusted in us enough to come back and join us. So I know where you come from, yeah. where you're a Northwest Iowa boy, but our audience doesn't. Yeah. Could you give a little bit of your background? Tell us a little bit more about you.
Yeah. So originally grew up here. Let me scoot up a little more.
Sure.
There we go. Originally from Sioux Center, Iowa. Grew up there all my life on a cow-calf operation, and then grew up around a company that a lot of people know called Transova Genetics. So was actively involved in agriculture, everything that way growing up. And then after I graduated high school from Sioux Center Public School, went on to Iowa State, wanted to do veterinary medicine, changed my mind after doing some job shadowing with some physicians in north central Iowa while working on a farm. But then transitioned to Des Moines University, and then from there kind of knew from the outset that I was thinking family medicine, and then found a great fit to come back here.
Good. We're glad you chose humans over animals, so that's good. Appreciate that. Why did you choose to come back to this area, and particularly joining Orange City Area Health System?
Yeah. So when I was deciding where I wanted to practice, the first thought is region. So I have family that's back close to home here. My parents still live in Sioux Center. My brother and sister-in-law, as well as my 3 nephews, also live in Sioux Center. And then our family farm, cow-calf operations between Hawarden and Rock Valley. So coming back to be able to help out there was the impetus for coming back to this location in general. With Orange City Area Health Systems, what I was looking for and what I found was A, great leadership, B, great physicians to work with and learn from, because medicine's ongoing and learning experience. So having good physicians to bounce ideas off of. I thought the staff that I've worked with in the ER has been great as well. Very accommodating. The patient base is definitely one that I enjoy working with as well.
Great, thank you. Well, you're joining a group of doctors and providers that we, of course, think are exceptional. Certainly, we have clinics in Orange City Hospitals and Paulina, and the various things that we offer in terms of services. Could you talk a little bit about what you might be particularly passionate about, where your interests lie, maybe personally and professionally, in terms of healthcare?
Yeah. What I'm most passionate about with healthcare in particular is continuity of care, and that's really what drove me to family medicine. So being able to take care of the patient and their whole family is something that I think means a great deal to me and helps provide the quality of care. So the second thing I'm very passionate about is providing quality of care. I like to do everything up to standard and be up to date on medical knowledge. As far as personal things I'm interested in, I like sports. I'm an Iowa State fan because I went there for school. My dad unfortunately brainwashed me into being an Illinois sports fan as well. So we have some tough games that go on there. But other than that, I still hang around the cow-calf operation, fairly involved with that.
Excellent. Well, we know that you grew up in this area, this part of the country. What do you think might be some of the important challenges that Northwest Iowa has, particularly regarding health and wellness? With COVID, we talk a lot about keeping our engines tuned and the need for proper nutrition and fitness and checkups and, from colonoscopies to mammographies to all those things that keep that engine tuned. So do you have any particularly health or wellness challenges that you see?
That's a good question, because I think Orange City and this hospital system is set up to eliminate a lot of the challenges that do come with rural medicine. One of the things I always heard when I was practicing in Sioux Falls was the challenge of dealing with stubborn rural farmers that don't necessarily follow up with their health care. I don't view that as a challenge since I grew up around farmers and working with them, and I don't necessarily agree with the stubborn portion, but getting the education out to them, making sure they're up to date with everything, and making sure I know their schedules, and people's schedules are extremely busy, especially in rural areas. So making sure that they get in and do it in a timely manner, I think is probably the biggest challenge.
Good. So we've kind of skipped over this part a little bit, but
Mhm.
you've mentioned cattle interest. That's a point. Several points, but so you're kind of a big cattle guy. I mean, you're
Yes.
still a cattle guy,
Yep.
and that's a very interesting aspect when combined with a medical doctor.
Mhm.
So can you tell us a little bit more about that? You know, what's the specific interest? What do you do? Is there any particular agricultural or maybe even producer
Mhm.
element to your practice you might look at?
Yeah. So it started with 4-H and FFA. I showed cattle for growing up. My sister and brother did. My dad did it as a kid as well. So it's something our whole family does. It's kind of been a family experience. What kind of grew off of that was that we developed a cow-calf herd where we raise cattle for show purposes. We have about 120 cow-calf operation. Have a sale every fall. So that's always a fun experience. I like being out to the farm, helping have cows, vaccines, whatever it is out at the farm. It kind of gives me the best of both worlds. In the hospital system, you don't get to be outside as much and enjoy the fresh air and do things that way. So getting outside and doing some of those things is something I really enjoy. And part of the reason I'll be excited to come back is be able to be out there more and do a few things that way. Um, the other part of it, grew up around farmers as well. My grandpa farmed on both sides. My brother-in-law farms. Most of my uncles farmed. So
So you get it. I mean, sometimes farmers aren't the most compliant with their proactive management of their health, right?
yeah,
I mean,
yeah,
so you get it, and maybe that's a unique aspect you can bring too.
yeah, yeah.
That's great. So you've been here a little bit. You've
Mhm.
been working in the ER periodically. Going okay for you?
Yeah, it's been fairly busy, but the staff I worked with have been great. The patients I've seen have been really receptive, and I've really enjoyed my time here.
Excellent. So that's certainly part of your job, but it's not your main focus here. The main focus is going to be family medicine.
Mhm.
And so I believe you are taking appointments now. Can you
Yes.
talk to us about when you're going to actually start?
So my first official day starting will be August 23rd in clinic. I am open for scheduling of those clinic appointments at this time.
Perfect. And in fact, today you're interviewing nurses.
Yes.
Yeah,
Yep.
which is secretly the most important part of a physician's practice
Yes.
is to have a good nurse that keeps things in order. So,
100%.
well, Dr. Faber, we're just terribly excited to have you here. I would like to welcome you here officially. And for all of you folks who want to start making appointments with Dr. Faber, have at it, 737-2000. And we trust and hope that he has a long and fruitful career here in Orange City. Anything else you want to add before we say goodbye?
I think that's all, but glad to be here and glad to get
Excellent.
started.
Good. Glad to have you. Thanks for joining us. And we appreciate your trust and confidence in Orange City Area Health System. Thank you.